In the treatment of depression, patients often have questions about herbs and other kinds of remedies. And it's important to know that CANMAT has evaluated this in terms of evidence and suitability. Here, we will just go over one table that provides summary recommendations of what we're calling complementary and alternative medicine treatments for depression, or CAM. So we are using our same format, first line, second line, third line treatment recommendations, and we are using our same way of evaluating evidence. We thought that the evidence should be consistently used in evaluating these treatments in the same way that we evaluated psychotherapy and medication. We are listing a single agent, namely St. John's wort, as a first-line treatment for major depression of mild severity. Note that we have qualified that recommendation to say that the depression is mild. In second-line treatments, there is the use of adjunct St. John's wort for moderate severity. There is acupuncture for mild severity, adjunct use of acupuncture for moderate severity, and there is adjunct use of L-methylfolate for either mild or moderate severity. When we go to third-line treatments, there are several agents there, and all of them have only modest evidence, but at least they have half of a pie, half of a green circle. And these third-line treatments include the adjunct SAMI for mild to moderate severity. There is DHEA for mild major depression, omega-3 fatty acids, which is strictly for mild severity. And there are reports which made it to the third-line recommendation, although we had a lot of discussion whether it was really appropriate. In the end, we did put it in these tables. So specific doses of saffron, lavender, or roseroot for mild severity of major depression. The decision to use complementary and alternative medicine treatments is a controversial one for clinicians. It's important in the initial phase that we consider collaborative decision-making and therapeutic alliance building. Collaborative decision-making is a key principle across all treatments for depression. If a person is shy about using medications, show them this table. Look at it collaboratively to help the patient pick what they want, but put it in a framework. That is, how will we judge if it is working, just in the same way that we judge if a psychotherapy or medication is working? And what you should do is engage in a discussion with the patient that you say how long we're going to try this treatment and how we will know that you find it useful. The time frame for that probably could be similar to what we use for psychotherapy or medication trials. So you could say, let's try this for 8 weeks before deciding whether to stick with it or change it. And you can also reassure them there's no harm in continuing or even adding psychotherapy while we're investigating this complementary medication treatment.